You a householder, Tiff?
Yeah.
Is that Almost place?
Hello, everyone. My name is Tiffany Hughes, and this speech will be on type 1 diabetes. Type 1 diabetes is a lifelong disease that occurs when the pancreas doesn't produce enough insulin to control blood sugar levels. Type 1 diabetes is also called juvenile or insulin-dependent diabetes, mainly because the cells of the pancreas produce no insulin, a hormone that allows glucose to enter body cells. Being a nurse, I've dealt with diabetes for some time, but it recently caught my attention when my 9-year-old cousin was diagnosed with type 1 diabetes. This has really opened my eyes on the effects of diabetes with kids. In my speech today, I will inform you of the many signs and symptoms that kids with diabetes suffer from, exams and tests to diagnose it, and what you can do to treat type 1 diabetes. Without enough insulin, glucose builds up in the bloodstream instead of going into the cells. The body is unable to use this glucose for energy despite high levels in the bloodstream. This leads to an increase in hunger, which is a main symptom of diabetes. In addition, the high levels of glucose in the blood cause the patient to urinate more, which in turn causes excessive thirst. Despite the increase in appetite, most kids actually experience weight loss with type 1 diabetes. Several other symptoms include nausea, vomiting, abdominal pain, and fatigue. How is type 1 diabetes diagnosed? Well, the majority of people who develop type 1 diabetes are diagnosed within a month of the onset of symptoms. Testing for diabetes involves drawing blood samples and measuring the glucose or sugar levels in the blood. In a random glucose test, a sample of blood can be obtained and tested anytime. A random glucose of 200 or above is indicative of diabetes when associated with the symptoms that we mentioned earlier. Ketones are present in urine when the body begins to break down an excessive amount of fat for energy. Ketones indicate that there is not enough insulin to prevent fat from leaving cells. The presence of ketones in the urine can indicate a serious and potentially lethal complication of type 1 diabetes. Well, what are the different types of treatment for type 1 diabetes? Well, insulin lowers blood sugar by allowing it to leave the bloodstream and enter cells. Everyone needs insulin. People with type 1 diabetes can't make their own insulin, and they must take insulin every day. Insulin is injected under the skin or inhaled. In some cases, a pump delivers insulin continuously. Insulin does not come in pill form. The injections are needed 1 to 4 times a day. People can be taught to give insulin by their doctor or by a diabetes nurse educator. Initially, a child's insulin may be given by a parent, but usually by the age of 14, kids are able to give their own injections. Insulin injections must be managed closely with diet. Meal planning for type 1 diabetes requires consistency to allow food and insulin to work together to regulate blood glucose levels. If meals and insulin are out of balance, extreme variations in blood glucose, low or high, can occur. Diabetes is a lifelong disease which there is not yet a cure. Type 1 diabetes can occur at any age, but is especially difficult for those many children that are diagnosed with this disease. It is inspiring to see how they manage this complicated and challenging disease. We have discussed signs and symptoms associated with type 1 diabetes, how it is diagnosed, and what the treatment options are. Thank you for letting me share with you the information I have found about type 1 diabetes. Thank you.
Stop.